Okay. Hello,
Hello?
Ms. Osterman?
Yes.
Hey, I'm Lance. I'm going to be your nurse today. We're going to be doing a physical assessment, and we're going to kind of be starting from the top and working our way from the bottom. So anytime you have any questions or concerns, we can stop, let me know. Any concerns you have for me right now at this point?
I don't think so.
Okay. Well, we're going to start with just a couple questions. Can you tell me your name?
Leslie Osterman,
Okay, Leslie, what's your date of birth?
11674.
Okay. I'm checking the patient's armband. Her it does coincide with that, so that information is correct. Okay. So tell me we told me your name. Tell me you know what time it is?
It is about 8:30 at night.
Okay. Do you know what month it is?
It is April.
April. Okay, great. Now, can you tell me what we're doing today?
We're doing an assessment today, and then we'll just discuss anything we find.
Perfect.
Thank you.
Okay. So the patient has clear speech, and her verbal responses were correct to the questions I answered. So I would say she's alert and oriented. Okay, so we're going to start at the top of your head. I'm going to be looking at her scalp. First of all, I'm just going to kind of assess. I don't see any protrusions, any bleeding, any cuts or bruises. Checking the distribution of her hair. I don't see any patches where it's missing. Her hair is clean, it's kempt. There's no patches of discoloration. Everything seems to be fine there. I'm going to be looking at her face for symmetry. Can you go ahead and smile for me? Okay. Can you frown? Okay. Can you puff up your cheeks and blow them out? Okay, perfect. Okay. And I'm going to go ahead and touch your cheeks or touch your face in a few places and tell me, are you feeling these?
Yes, both.
Both sides?
Yes.
What about the forehead?
Yeah, both.
Okay. And the chin?
Yes, middle.
Okay, great. And when I was doing humming and blowing out, I'm checking for the cranial nerves of 3, 4, and 6. And then on the face, cranial nerves 7 and cranial nerves 10. Okay, so then we're going to come down, I'm going to look at her eyes. First thing I want to do is I want to do a diagnostic positions test, or the 6 cardinal fields of gaze. So what we're going to do is I'm going to have you follow my finger.
Okay.
Okay. And I want you to keep your head still and then just follow with your eyes.
Okay.
So we're going to start. Ready? Okay. What I'm looking for any nystagmus, any extraocular movements. Okay. And some nystagmus can be normal. And then let's switch over here. Okay, I'm not seeing any extraocular movements. Everything's nice and smooth. Okay, great. Now I'm going to look at their eyes and look at the symmetry of her eyes. Okay, I don't see any everything looks symmetrical. I'm going to look at her lids. There's no styes, no swelling, no inflammation. I'm going to look at her lashes. They're not matted. They're not stuck together. The conjunctiva are not red or swollen. Then I don't see any signs of infection. The sclera of her eyes. I don't see any redness. Any inflammation there. I don't see any type of injuries to the cornea, the iris. Those all look intact and appropriate. Pupils are round. So what I'm going to do now is I also want to check your pupils.
Okay.
Now I'm going to shine a light in your eyes here, and I'm going to be looking to see if your pupils react to the light. Okay. Now both eyes will go a little smaller. They will constrict. Not too loud, right? Okay. It's not that I thought this thing was gonna go a little down on me there. Okay. So her pupils, they're equal. They're round. They are reactive to light. Now we're gonna check your accommodation. Okay. What that is, I'm gonna start here with my finger.
Okay.
And I want to take it out. I'm gonna get a little bit brighter of a light. It's a little darker in here. Okay. Follow that. Bring it back in. Okay, same thing. Follow that. And you can see they'll dilate and contract when they come back, and when I bring it back and take it back in. So that her pupils are accommodating. Okay. Now what I would do is with my ophthalmoscope, I'm going to come over to the side. I'm going to look for her red light right reflex. So I'm going to come over about 15 inches out, about 15 inches to the side. And I'm going to shine this towards the back of her eye. I'm going to look through, and what I should be seeing, there'd be a reddish to orangish glow on her eye. And what that does, it's the vascularity and the fundus of the eye. So it could be a tool they use to diagnose things from, say, different types of ocular tumor. Okay. Perfect. I've got a nice reddish orange glow on both of those. All right. So we're going to come down. We're going to take a look at her ears. So I'm going to inspect bilateral. I'm going to inspect the auricle, just the outside of the ear. Okay. No lesions. No, skin's intact. Seems to be formed functionally. I'm going to look at her tragus. Okay. Same. And I'm going to feel her mastoid process. Feel for any kind of heat, any type of infection. And is this tender at all? Okay, great. All right. Now I'm going to come back to her nose. So I'm going to look at her nose. First thing I'm going to do is I'm going to inspect. Okay, it looks symmetrical. Skin's intact. I don't see any bruising, anything that might affect the the use of her nose. So what I'm going to do is I'm going to include one of your nostrils and breathe in and breathe out through the other. Okay.
Okay.
All right. Is that clear? Able to breathe?
Yes.
Okay, same thing. Perfect, same?
Mm-hmm.
Okay. Now I'm going to look inside of her nose. What I'm looking at is, I want to look at the turbinates. Okay, just go ahead and breathe for me. I'm also looking at to see if they're inflamed, if they're, occluding the nasal passages. I'm looking at the mucosa. It's pink, it's warm, looks moist and intact. I'm also looking at the septum. I don't see I don't see any deviation of the septum, so it looks appropriate. Okay, I'm going to come down, look at her mouth. So I'm going to assess it. I see the lips on her skin, the skin of her lips. I don't see anything cracked, or any sores. Let me go ahead and open up for me. I'm going to look at her dentition. Okay, let me see your teeth real quick. You can go ahead and keep that tongue back. Perfect. Okay, let me see your gums. Look here. Okay, gums are pink, moist. With the dentition, everything, the teeth are intact. I don't see any extra, crumbling, any broken teeth that might cause any types of infection. With her gums are pink and moist. I don't see any splotches or any type of white patches that might be signs of any type of infection. Let me go ahead and assess your tongue again real quick. Okay, tongue's pink and moist. I don't see any beefy red tongues. Now while I'm here, I'm also going to go ahead. Can you go ahead and say "ah" for me again? Ah. Okay, great. Now I'm assessing. I can see her uvula and her rhizome and the soft palate rhizome phonation, and her mucosa. Like I said, it's pink, moist. I don't see any types of infection. I also assessed her. Go ahead and open up one more time. I assessed her tonsils. They're not inflamed. I don't see any tonsil stones, any signs of infection, and they're not occluding the.
Excuse me.
I know. Thanks for going, right? I understand. Okay. From the mouth, I'm going to go ahead and go to her neck. So what I'm going to do is I'm looking for symmetry. Her neck looks symmetrical. I don't see any problems. There's no signs to say I take a shrike. There's no bulging discs. I don't see any pulsations anywhere. Okay, so what I'm going to do is I'm going to have you turn in against a little bit of pressure. Go ahead. I'm going to have you turn to the left.
Okay.
Perfect. Any problems? Any pain?
No.
Turn to the right. Great.
Okay.
Now go ahead and try to push your head back. Okay. And same thing. Push forward. Okay. And you can move left and right, back and forth. Any click?
Yes.
I don't hear any clicking. Any pain? Okay.
No.
I'd say she has full range of motion of her neck. Okay. From there, I'm going to go ahead and come down and listen to her heart. Now, what we first want to do is we want to find the point of maximal impulse. So we're going to come down here to about the fifth intercostal space, and about mid-clavicular line is about where we're going to find her PMI. So I'm going to go ahead and listen to that. I'm going to go ahead and get an idea of what her apical heart rate is. she's gonna be about 61 beats a minute. So normally we would listen for a full minute, but I went ahead and listened for 15 seconds and just multiplied that out. So, okay. So where we would normally listen to the heart, we're gonna go ahead and listen to your heart in a few different places. We're gonna find we're gonna listen to the apical pulse, or excuse me, an acronym would be abdomen, but we're gonna listen listen to pulmonic. We're going to listen to Erb's point. We're going to listen to tricuspid. And we're going to listen to the mitral. Okay, and we're going to flip my stethoscope around. Same thing. Okay. Now what I'm going to do is I also want to have you go ahead and lay on your left side for me.
Okay.
And we're going to listen to the apex of your heart again while you're listening, while you're on your left side.
Okay.
Okay, and again, with both sides, so if I didn't hear any murmurs, any extra hard sounds that would cause concern. Okay, so while you're down there, I'm going to go ahead and have you lay flat on your back for me.
Okay.
We're going to take a look at your abdomen. So first thing I'm going to do is I'm going to assess the abdomen. Is it symmetrical? I'm going to look for any type of different type of shape. Do I see any type of pulsations? Do I see any peristalsis movement that would not be considered normal? Look at the umbilicus. Okay, I don't see anything bulging, say from a hernia, so that's going to be what I consider appropriate. So what I'm going to start doing is I'm going to listen to a few areas before I palpate in your abdomen. You know, generally we want to listen to to the upper and lower left and right quadrants, but there's actually about 9 different places we can listen to, but we'll listen to about 6 or 7 here. All right, we've got nice, strong, active bowel sounds. Okay, so what I'm going to do is I'm just going to kind of go lightly, and then I'm going to palpate lightly in all these areas, and then I'm going to go a little deeper. Now, Ms. Osmer, what I'm going to do is we're going to check for some rebound tenderness. So when I do the deeper palpation, when I let back, you tell me if there's any pain that comes back with that, okay?
Okay.
So here's some light palpations. I don't feel any organs that might be swollen, any types of signs of infection that I could be feeling. Okay. I'm going to go a little harder. Okay. Any type of rebound tenderness anywhere? Okay. All right. Okay, I'm going to go ahead and have you sit back up.
Okay. You may turn.
Yeah, go ahead and hang those feet off the bed for me. So now, while I'm here, let's make sure we're still recording. Excellent. I'm going to locate the end of her rib cage here. I'm going to check for her CVA, costovertebral angle, and right around the spine, it's going to make a little point, almost like a little arrow. So what I'm going to do is we're going to assess for rebound tenderness again. I'm going to go ahead and put my hand on your back here on both sides.
Okay.
I'm just going to give it a little thumb, and when it comes back, when it rebounds, you let me know if there's any tenderness. Anything?
No.
Okay.
No.
Anything? Great. Okay. Now, while I'm here, I'm going to go ahead and assess your lungs.
Okay.
So what I want you to do is just kind of have to take some good deep breaths, just breathe normally in and out for me, okay?
Okay.
There's about 10 places, the anterior and posterior I'm going to check for lung sounds. I'm also going to check for the symmetry of when she's breathing. I'm going to be looking, hey, is there any type of flail chest going on? Are we breathing symmetrically? Are we using any accessory muscles to breathe? So I don't see any use of the accessory muscles. At T9, T10, everything looks symmetrical. Any issues with any breathing? Any urge to cough, anything like that?
No, sir.
Okay. I'm also going to check. I can look at her skin turgor here. She's well hydrated. There's no tinting there whatsoever. Okay. I'm listing these 10 different spots. Okay. Okay, lungs. We're going to do the same thing in the front. Okay, go on the sides here. Okay. Our lungs were clear to auscultation. We've got no wheezes, rhonchi, any rattles, things like that. Lungs sound good. Okay, so while we're here, I want to go ahead and I want to assess your upper arms. We're going to check some movement. We're going to check some reflexes. First thing I'm going to do, I'm going to look for symmetry. I'm going to look for color. Everything seems appropriate there. I don't see any extra moisture from, say, like weeping, so no issues for like skin breakdown. Temperature seems to be appropriate. She's not cold or warm. Well, I want to look at, I'm going to go ahead and check your pulses here.
Okay.
Okay, bilaterally, I'd say about 2 strong plus pulse. Radial pulses, let me check your brachial pulses. Okay, same, I'd say both are about a 2 strong plus. Okay. While we're also doing that, we're going to go ahead and I want to look at our fingertips. I want to go ahead and assess our cap refill. Okay, it's definitely less than 2 seconds. Pink, moist. I'll look at our fingernails. I don't see any clubbing. They're round. Don't see any signs of infection. I would say she's getting appropriate oxygenation. Okay, I want to check some range of motion and some
Okay.
strength. So why don't you go ahead and pull back against my hands.
Okay.
Okay, nice and strong. Then go ahead and push back. Great. Okay, you can move your wrists. No issues there. No clicking. No sounds. Okay, same thing. Try to pull back against me with your
Okay.
with your arms like you're doing a curl. There we go.
Okay.
Okay, and push back against me. Same thing. All right. You can raise your shoulders up. Okay. Roll them back and put your arms up. Move them around. Go back around, anything like that. Okay. Any clicking? Any extra pain?
No.
Okay. I would say she's got full range of motion on the upper extremities. Now, while we're here, I'm going to go ahead and assess her lower extremities. So we're going to do kind of the same thing. We're going to look for symmetry. I don't see any signs of any devices, any types of surgeries where she's had anything orthopedically done. So I'm looking at her skin temperature. Seems to be appropriate, like the upper arms were. No skin integrity is fine. It's pink. It's warm. I don't see where it's any extra moist that would cause any type of maceration or skin breakdown. Looks good there. We're going to go ahead and I don't see any lesions, either that or on the upper arms as well. Now we're going to do the same thing. I want you to go ahead and push down against my feet.
Okay.
We're going to check some range of motion, some strength.
Okay.
Okay. Try to pull up. Great. Okay. Now I want to check both of her salus pedal posts and the tibialar, yes, tibialar posts. Okay. Posterior tibialis posts. There we go, I can speak. Okay. All right, we got a good strong pulse there. We're going to check both of these. Okay. Okay, now I want to check her deep tendon reflexes for her Achilles tendon. So what I'm going to do is I'm kind of hold her foot in a neutral position here, and then I'm going to go ahead and tap with my stethoscope in the back, and what we'll see is going to be her foot is going to be, if it's working appropriately, it's going to be driven down. So ready? Go ahead.
Mm-hmm.
Can I felt it a little bit?
Mm-hmm.
Okay. Okay. Okay.
Yeah,
there
that
we
was
go.
good, yeah.
Okay. And I want to check. You can feel. Did you feel both these equally?
Yes.
Yes, you did.
Yes, I did.
Okay. Now, one thing I also want to do is while we're up here, I want to go ahead and check your brachioradialis. I'm going to kind of deep tendon reflex. I'm going to go ahead and pull that. Same thing. So what I'm going to do is I'm going to kind of tap with my stethoscope. Ready?
Okay.
Okay.
That always feels so weird.
Yeah, it does. Okay, ready?
Sorry.
Okay, perfect. Okay, well, I want to do is I want to go ahead and assess your gait.
Okay.
So if I can just have you get up and walk back and forth just from here to here. Okay, just go ahead and walk to me.
Normal?
Stop, yep, turn around and head back. As you can see, she has a normal gait. She doesn't shuffle. She doesn't dribble one side. Both sides look equally strong. And I think that's going to go ahead and conclude our assessment. Ms. Osborne, do you have any other questions?
No, thank you very much.
Thank you very much. Have a good day.